quite ready for Pitocin, like if you are just, 1 or 2 centimeters dilated, if your cervix is still pretty thick, it can take a while for your body to kind of get into labor.
Okay.
So the balloon, it is definitely, like I said, it is not a walk in the park. It's not the most comfortable thing in the world, but it can really help your cervix get a little bit more ready for the Pitocin, if that makes sense. So the Pitocin is something that's, a fairly strong medicine. It doesn't work as effectively if your cervix isn't open very, very far. So that's where the balloon kind of comes in to help. If you are like looking at that and you're like, that looks like the worst thing in the world, I really don't want it, you don't have to get it, but it really truly can help. So you can kind of think about it. And like I said, I will definitely check you, and if by some miracle you're like 3-4 centimeters, we can absolutely just do the Pitocin right away.
I kind of figured. Okay.
So the way that this balloon contraption works is when your cervix is open like 3 to 4 centimeters, it will fall out. So it doesn't stay in forever. It just kind of helps to put a little bit of pressure on the cervix until you're 3 to 4, and then it'll fall out. And what we would do if you did decide to go with the balloon, we could put it in and then start low dose Pitocin at the same time. So that way, by the time the balloon comes out, you've already had a little bit of the Pitocin too, and then we can just bump it up a little bit more once the balloon falls out.
Okay.
Does that kind of make sense?
Yeah, it makes sense.
Okay.
And I have another question.
Yeah.
What pain medicines do you guys have available?
Excellent question. Excellent question. So there are 3 main options that we offer here. You had your last baby in Tuba, right?
Yes.
Okay. So some of them might be a little similar to what they had in Tuba. Some of them might be a little bit different. So 3 options. First option is something called nitrous. Have you heard of nitrous before?
The mask?
Yep, exactly. Did you use that before?
No.
Okay. So it's something you breathe in with a face mask. It's attached to like this little machine contraption looking thing. And it's something that you breathe in and out. So the medicine flows as you breathe. If you are not breathing, the medicine's not flowing.
Okay.
So the way that medicine works is it's, again, completely at your control. So you bring the mask up to your face when you feel like you need some pain relief, like right before the start of the contraction ideally. You breathe it in and out during the contraction, and then when the contraction's over, you exhale, and then it's out of your system. So the way that that medicine kind of helps is it helps to kind of take the edge off of the contraction a little bit, so you're still gonna feel the contractions. It's not gonna be like complete pain relief, but you're gonna feel a lot more comfortable during the contraction itself. The other nice thing about nitrous is it kind of helps you get into the rhythm of breathing well with your contractions. So that can be a really nice option, especially to start out with too, just to kind of, remind yourself, okay, this is how I have to breathe during, any labor contraction, because the medicine won't flow if you're not taking those big deep breaths in and out. So that's one option. Another option we offer is IV pain medicine. So you are going to be getting an IV inserted. We're also going to have to draw some labs and stuff like that on you. And then once the IV is inserted, if at any point you decide you want to try IV pain medicine, we can give you some medicine through the IV. Similar to the nitrous, it's not going to be complete pain relief. So you're still going to feel the contractions, but you should be a lot more comfortable during the contractions.
Take the edge off.
Exactly. And the other thing, the kind of biggest difference between the IV and the nitrous is sometimes the IV medicine can also make you a little sleepy. So if you are super tired and you haven't gotten a nap in a day or 2, and you're just I need to kind of hit the reset button, that can be a nice option if you just want to try to rest, especially in between the contractions. As we've been saying, you're still going to feel the contractions, but you should hopefully be able to rest and relax in between, and it will help take the edge off.
Okay.
So if you don't think you can be like awake and alert enough to be breathing in the nitrous every single contraction, we can give the IV medicine, and once it's in, it will stay in and work for at least a few hours. Everyone processes medicine a little bit differently, and there's different types of IV medicine we can give. So if you're like really, really early on and you want something that's gonna last you a little bit longer, we have medicines that are gonna last a little longer. If you are, 8-9 centimeters and you're like, I just need something to really take the edge off for like this like last little bit, there's medicines we can give that are super short acting. So there's never a point where it's like too late to get something typically, unless the baby's really right there and coming up. So IV pain medicine can be given, at varying points. As it can make you a little bit sleepy, we don't typically want to give it like super, super, super close to your delivery, because the baby can sometimes come out and be a bit sleepy. But if we had to, like if you were like 7-8 centimeters and you wanted something, we could still give it, and it's okay. And then last but not least, there's something called an intrathecal, which is kind of similar to like an epidural. It's the shot in the back, and it makes you pretty numb from about here down. So if you needed something that's like really gonna take away the intensity of the contractions, we can definitely get that for you. We have to call anesthesia in to place it. And typically we like to wait till someone's at least 7 centimeters or so before we give it, because that one also just lasts like 2 hours on average. So you can mix and match. You don't have to pick, just one. If you want to start out with, IV pain medicine and then later on get an intrathecal, you can do both of those. If you want to try all three, you can try all three. You don't have to have, plans set in stone. We're totally flexible. You can let us know if one option sounds, particularly good in the moment versus another. Do you have questions about any of those?
No, I think if anything, if I start feeling pain, I'll start off with the IV.
Okay. Absolutely. So just let us know.
Low tolerance for pain, I can't. That's okay.
Labor's intense. We're here to help you through it. So you let us know if you feel like you need something, and then we'll kind of work with you and see where you're at. Did you use IV pain medicine in your other waivers as well? Do you remember?
I don't think with my last one, I just went straight to the third one you were telling me about.
Okay.
I think it's the generic epidural.
Yeah.
Was it epidural or
Tuba does have epidurals.
It was epidural.
Okay.
Because that's the reason why I wanted to deliver there, because of they had an epidural.
So the intrathecal's really similar. So if you can, get through until 6-7 centimeters. Did you ever have like any pretty quick deliveries? Like never. Okay. Okay. Nah. Well, if somehow this one's real quick, if you're like 6 centimeters and making really, really, really quick change, we could get an intrathecal then. But we don't want to give it too early, because then the downside is if it wears off, then you're gonna get pain again before the baby's out. So we'll try to time it if that's something you're interested in as you go.
I did ask around. I did read up on the mask.
Yeah.
I look at a lot of, like, it doesn't work. It's just too much going on and on. It's like, okay, I won't do that one.
So everyone is totally different with that. In my experience, so if you can get into the rhythm of knowing how to breathe with it, and that's why I said kind of early on it can be really nice, because if you can figure out how to breathe with it and you get into the rhythm of doing it, it can be amazing for people. If you are, 6-7 centimeters and losing your mind and you like are having a hard time breathing to begin with, it's not going to be your best friend, because you're already like, anxious and kind of all over the place. So that's why if you think, if you're like 4 centimeters or so, and you're,
and she's talking to you.
yeah. So if you're like 4 centimeters and you're like, things are, getting a little intense, but like, maybe I'll try something first. That can be an option if you wanted to try it. You can see how it affects you. As I said, it's totally out of your system once you breathe it out. So if you do hate it and you're like, this isn't for me, you don't have to continue using it. So it's something you can try if you want it. If not, no harm, no foul. Do you have any other questions or preferences?
No, I think that's
Okay, sounds good. And then, is there anything else, like, do you want him to cut the cord once the baby's born? You're good with us putting baby skin to skin with you? Wonderful. Do you know if you wanna keep the placenta or not?
No.
Nothing like that, okay. And again, just let us know if you think of something that, you didn't let us know earlier, just tell us at any point.
okay. And I guess I can hang in there until I feel. I would like to try to hang in there until I'm like 5 centimeters and then get pain medicine.
Yeah.
Try to.
Yeah, no, I mean, we are here if you need anything.
Okay.
So the other thing is, every room also does have, a shower. If you're not on Pitocin, you can get in the shower, for a little bit. We have to have you on the monitor if you're on the Pitocin, so we know how baby's reacting to the contractions, and so we can see how often you are contracting. So, if you're on Pitocin, you can still get up, move around, as long as, we're able to trace the baby. We do
Am I
have,
able to walk?
yes, we do have one, monitor that you can even walk around the hallway with if we're able to hook it up. It's a portable monitor, so you can get up and walk. At the very least, you can walk around the room. And we have birthing balls if you wanted to get on one of those big balls. Have you tried one of those before?
My legs are too short.
We have small ones.
Okay.
So I'm short too. If you want to try one, I can get you a small one. You can see if you like it or not. So
Okay.
that can help. And then just try to change positions every once in a while, because that will help the baby to kind of come down and rotate too. Okay?
But he's good though. He's good. I mean,
I'm just getting him on.
Yeah,
monitor.
just getting him on.
Yeah.
So,
fully developed everything.
As far as his age, yeah.
Okay.
yes, yeah. So, I know Trish was telling you, we typically recommend inducing
Yeah.
someone by 41 weeks if someone hasn't gone into labor. That's just because as the placenta, gets further and further away from your due date, a term pregnancy is a term all the way up to 42 weeks. But, the further out you get, like a week out from your due date, there's just, a little impetus for us to at least start labor if it hasn't started already, to kind of get you delivered by 42 weeks.
Okay.
Because at that point, the placenta really doesn't do a great job of carrying oxygen.
The
to
other
the
lady I
trace.
spoke to on Wednesday, I can't remember her name.
Susan. Mm-hmm.
She had mentioned that my baby's smaller than her,
Mhm.
so that's why I was like, okay, so is he good?
So, we'll see on the monitor, and right now, baby's looking great.
Okay.
So far, baby looks really good. So if the baby truly is, on the smaller side, the pediatrician, will do some follow-up with you and chat with you guys once the baby's out. Sometimes we get an ultrasound and the baby looks small, and then the baby's born and is a totally normal size. So, ultrasound can certainly be, inaccurate, especially the further out you get. Sometimes, the ultrasound shows a totally normal sized baby and it's a 10-pounder. So, we'll take it as it comes, and we'll see how big the baby is once the baby's born. Okay, but, I am gonna do a quick ultrasound just to check and make sure baby's still head down today as well, before we give you any medicine to start your labor. Did you sign a consent form stating that you did wanna have what we call a trial of labor after cesarean, either in Kayenta or here?
I don't remember.
Let me at the very least have you sign that, even though you've had all vaginal deliveries since your C-section, every single time we still have to have you sign the consent form. So let me go grab one of those just so that we make sure we have it, and then I'll be right back in, okay?
And then you start your labs, you feel comfortable, right?
Yeah.
Start your labs. Get you all ready to go. You have some water over there for both of you.
Okay, thank you. Yeah. So which one's him? The blue one?
Yep.
And I'm the one on bottom?
Yeah, the flat one. So the top one measures his heartbeat,
Okay.
and the fact that it looks like a squiggly snake, that's good. That shows that he's like developed and neurologically ready and his blood flow's good. And then the bottom one is, it measures your uterine contractions, which right now I don't see a whole lot of, and that's okay. But eventually it'll look like a hill and then a dip, and a hill and then a dip. So, yeah.
They're like waves, huh?
Yeah, the
It
bottom
will
one
be.
will be.
Yeah, the bottom one's a little flat right now, and that's okay because you're not having contractions so much right now. Your belly's kind of. Let me fix the top monitor. And then you just enjoy, and I will do all the worrying for you, okay?
So where'd you come from?
South Florida, yep, Fort Lauderdale area.
Oh wow.
Yeah. and I'm
My
up here
brother
for-
was in Florida and now he's in North Carolina.
North Carolina.
Oh, that's where I want to
he's
move.
been in.
Okay.
You just moved there.
Yeah, he just moved there.
Where
I don't-
about?
I can't remember.
Okay. If it comes to your mind, let me know, 'cause I'm always open to hearing where people are.
Cool.
And I'm gonna start your IV. Okay.
Yeah.
Okay, so let me see here. Okay, so, all right, see if you can get that one in, and then we've gotta get her admitted in the computer because Kristen can't do any orders.
okay.
So, do you want me to put her in the computer?
That'll be great.
Okay, I'll go ahead and get her in there.
Can I walk around with that thing in me?
Yeah.
Okay.
Yeah.
Alright, Lisa, do you mind if I plug this one right over there? Thanks. And did you have another visit in between when you saw Susan, and now, did you have a visit in
No.
Kayenta or not? Okay, not a problem. Alright. So this right here is the consent form. I don't know if this looks familiar to you or not, but desires a vaginal birth after your previous C-section. What we call it is a vaginal trial of labor to try to have a normal vaginal delivery. Right here it says that the success rate is about 70% for you with having had 3 prior vaginal deliveries. Your success rate is probably somewhere like 80 to 90% likely. The reason why we have you sign a consent form is because when anyone labors after having a previous C-section, there's an extremely small risk, but of, over something called uterine rupture, separation of the scar on your uterus requiring emergency surgery. So it's a really small chance that that could happen, but because it's such a significant thing, we have to have you sign the consent form. So really, really low chance of that, like less than 1% chance of that happening, especially with, successful vaginal deliveries with no complications before, but that is, the risk. And the alternatives would be getting another C-section.
Yeah.
Any questions about that? The, as I was saying before, there's medicines we can't give you because you have had the previous C-section. So, that's just something that we do to minimize the risk of that happening. Okay? So if you want to try for a vaginal delivery, I'm gonna have you sign there next to that X. Yep. And it is 45.
Already?
Wow, we've been here for 45 minutes.
Yep,
Yeah.
time flies. So, we're gonna get everything going as fast as possible. As I said before, I am going to just make sure baby's head down. So I'll do a quick little ultrasound. And I'm actually gonna grab, there's a little, secret compartment with some towels in here. So what I'm gonna do is just lay you back just a tiny bit so we can check and make sure there's a head down there. any point you need to get up and use the restroom again or anything like that, just let us know, okay? Turn this towards you. You can see, so you're gonna feel a little bit of cold gel right on your belly.
Is that a contraction or no? That is
No, that is just baby looks lovely.
Oh.
Baby looks really good. Baby's heart rate is having some what we call accelerations. It doesn't look like you're having any contractions just yet, which is okay. It can happen.
Yeah,
The bottom one,
But
yeah.
that's gonna hit like way up here
Yeah,
and come down.
don't think about that
Yeah.
yet. But baby looks great. Baby looks fabulous. Baby's excited. So, let's see.
When it goes up, that's
Yeah.
when you're contracting, that's when they tell you to start pushing.
Yeah, and there's your baby's head. So baby is behaving, baby is head down. Do you guys know if you're having a boy or girl, or is it a
Boy.
surprise? A boy. Wonderful. Great, and the baby's back is kind of curved up this way. Okay.
They were saying, yeah, last one I saw spine, huh? Cameron, was it like Kendra?
Kendra.
Kendra was spine.
That can be why you maybe had some longer labors before. So right now baby's head down and the back's kind of curving up this way, so that's good. With the baby being spine to spine with you, that means the baby's kind of looking up to the sky like that. And babies can obviously still be born vaginally, but that is the hardest position for you to labor in. And it can cause more intensity, more back pain. Do you have any back pain right now?
Not now, but the other days I did.
Mm-hmm. So, right now, baby's not OP. No, her other babies were.
Oh, I gotcha. I was like, wow, you're good with that ultrasound, man.
No, but baby is head down. So, if you do start to get back pain, one thing that can sometimes help the baby to kind of rotate and turn is if you get in the bed onto your hands and
That's what I
knees.
had to do for 1 hour.
Yeah,
For a child.
yeah. So if you get back pain, I'd recommend that. If you're feeling fine right now, you don't need to stand on your head or anything like that.
We call it birth acrobatics.
It's exactly 1 hour.
That's when they said, oh, you're ready now.
How fast was your last labor? Do you
I
remember?
remember 12 hours?
From start to finish?
Yeah, I think so.
That's not too bad. Although it's easier for me to say.
It's real
You're
easy
not
for
the
us to say
person
on
in
this
labor.
end. It's like, this isn't gonna hurt at all, not me. I've done this 3 times, so I feel you.
And I've just like you, my first baby was a C-section, and then my following 3 were vaginal.
Yeah, my first was a vaginal, and my next 2 were sections. So we've done them all.
We've had it all.
We've got you, 'cause we figured it. We figured it. And I said sometimes it's nice because, you know, when you have the new nurses like right out of school and I call them the baby nurses and they haven't had baby and they're like, oh, it's not, and we're like, you haven't been there yet.
Don't talk to a woman about
Yeah.
that.
It's like, you come back when you had a couple of them. Then let's talk about how much that hurts.
That's so
Yeah.
true. That's so true. Relax your arm down. I'm gonna find a good vein and get this done. Make a fist. Make a fist for me. Just hold it right up.
So pretty out today.
Yeah.
Today was the first day where it wasn't like devastatingly cold for me.
You're just a Florida girl.
I am. I'm just gonna rub some alcohol.
I had my windows open. I'm in an RV. I had my windows open. I had the ceiling fans going. I was ready to flip the air on, and my husband's like, no. It was very tempting. Very tempting. Just the wind wasn't blowing us off the hill. Geez, look, that's the one thing here is the wind.
The wind.
And growing up, I used to watch cartoons, and you know, I would see the tumbleweeds, because you know, I didn't know what tumbleweed
Yeah.
was. I didn't think they were real until I moved out here.
You want me to count to 3?
And then I was like, oh my gosh, what is
Keep
that?
your
They're like,
fist.
that's a tumbleweed. And I'm like, no way, they really have tumbleweeds.
Yeah.
So we learn all kinds of fun stuff
When
out
I
here.
was young, elementary maybe, about to do a report on what would you do here.
Mm-hmm.
I was like, we should plant a lot of trees. The incoming town.
Yeah,
Not like so many trees, tall trees, fruit trees,
yeah.
and that'll stop the most of the wind as a barrier.
Yes. I know these things are stupid. They're really stupid. Okay, so the best thing you can do is do like that. Now take that and put it right there. There you go.
You did good, Mama, you
Yeah,
can release
these-
your fist.
Everywhere you go, you have different types of IVs that you use. So it's crazy. There's not like a universal. So we have different adapters. So
Like, I know what I'm doing.
yeah,
but
she's
that's-
been a nurse forever. She's a traveler, so she's done this forever, but she has to learn the Chinley way.
Oh, wow.
And so their
Yeah.
tubes are different. Their IVs are. When I first came here the first time, I was like, I've been a nurse since 1996, and I'm like, what is that? And they don't want to come loose, and you have to learn. So she's learning the Chinley way right now. But yeah, she comes out of a very high risk L&D, so she's a bomb. So I'm just here like, if she has a question, because she's getting ready to be turned loose, so yeah. So you got it, girl. Look at that.
I'm making a mess, but I'll
That's
clean you
alright,
up.
I make them every time, honey, there you go, you flush great. Yeah, don't look. Don't look. Girl, I am such a messy maker, I mess so much.
But
My
we
son's
got what
like-
we need and you got a good IV.
Yeah, my son's like, you need to learn to do that a little bit better. I'm like, listen, he's the trauma guy. He can pop these things in going down the road in an ambulance. I'm like, not me, man. I like to take my time and make it look pretty.
Yeah.
Yes. Yeah. Don't forget to date and time it because the IV police will get you. Girl, they come in and they're like, no date. And then they come, they're like, make sure you're dating. I do this all the time. I'm like, look, they got an IV and it works. Let's just be happy. See? All's good up in our neighborhood. I'm gonna get rid of this, and where's your needle? I'm gonna get rid of your needle officer.
Thank you.
You welcome. This is the happy floor in this hospital. We're just like really laid back, go with the flow. Awesome.
Do you have any allergies?
No.
Okay. And how tall are you?
5'1".
Okay.
Maybe almost 5'1".
If you think about it, right? Okay, Daddy, you get the IV next. I'm kidding. Okay, so you can move your arm. I put this in a spot where you can bend your arm and move your wrist, okay? That's kind of how I like to put mine.
Yeah.
I'll give you an extra alcohol so that you're not so damaged looking.
That's what I always ask for too.
Put it in the side, right?
Right.
Okay, Mama. Bring you down to the ground. So this is Mr. David in there?
Yeah.
Okay.
Little mister.
Be a good nurse and sign a date list. Let's see what's today.
For the police. Did you say that I do police get you or
Seriously. It's for real. What time is it here?
Okay.
Wow, see, my watch every day, at some point, it forgets and it doesn't go fast enough. It's so annoying.
Gotta change out your battery. I got the by the equal. Fire.
gonna be for you. One of, you're gonna have 3 bands by the time you leave here. Which is 3, 8,
I'm good.
Scared.
Yeah.
Just
The
take one at a time.
one that goes up high, that's when they want you to push. The one that comes back down, that would be.
So I think we're gonna go with that balloon.
Yeah, I've seen that used a lot, and it's really good because that's called like a mechanical induction. It's just giving your cervix a signal that if there's pressure there, then your body has a tendency to start producing more natural oxytocin. So
Wow,
it,
so it's natural.
yeah, yeah. Versus when you start to do the Pitocin, you know, that's the same hormone as oxytocin, but it's just a little bit of a jump start.
Yeah.
I'm gonna get these sent off,
Okay.
and then I am gonna come back and go over your admission questions. I have like 17 pages of questions for you, okay?
Okay.
I'm kidding,
Oh
but I
my-
do have lots of questions.
Oh my, wow.
I'll be right back.
How you doing, babe?
Nervous.
I'm nervous for you too. Top one is David, bottom one is Mommy. Yeah, I know. But I know you'll do like a champ. Love you.
Love you.